Welcome to this edition of OBG Talks. My name's Oliver Cornock. I'm the editor-in-chief here in London, and it's great to be talking to our Africa regional editor, Souhir Mzali. Welcome, Souhir. It's the first chat we're having here. I've spoken to our regional editors in the Middle East and in Asia. Now it's Africa's turn. On the face of it, of course, the continent, the world's poorest continent by many metrics, has had a slower pace of COVID-19 infection, fewer deaths. And I'm wondering really why that is. Is it testing, is it communications, or is it just simply not reporting? What do you think?
Yeah, so Africa has about, I think, 30,000 cases as of today, and just over 1,300 deaths. And as you said, Ollie, it's been slower. The pace has been much slower than what we've seen elsewhere in the world. And in my opinion, I think this comes down to a few reasons. One of them being, well, connectivity, for one, the fact that something that was long seen as a challenge in Africa could be seen temporarily as a blessing in a way. The fact that, you know, people aren't able to move around as easily as they do elsewhere in the world, especially, you know, Europe, the United States, where we've seen, you know, numbers skyrocket. I think the fact also that the continent doesn't have the ability to test at the same level of other countries, you know, again, you know, we're talking, you know, Europe, the US. I think that may present one reason why we've not seen numbers, you know, as high as, you know, elsewhere. And then, you know, maybe also the fact that Africa has the world's youngest population. I think more than 60% are under the age of 24. And knowing that, you know, the coronavirus does tend to affect people who are much older in age, these could be maybe reasons why, you know, it's been so slow in Africa compared to other places in the world.
I suppose the horrors of the Ebola outbreaks are fresh in people's minds as well. To what extent do you think African governments have been prepared by that?
I think Africa is probably better prepared than it would have not been, you know, without the Ebola having happened. The thing with Ebola is that it was quite contained. Ebola was mostly present in West Africa, and, you know, it was something that happened in Africa, and the continent was able to get help in that sense. Whereas, you know, with coronavirus, we're looking at an imported disease. Still, I would say the continent does suffer from a underdeveloped health system, despite the fact, you know, they have to deal with so many transmittable and also, you know, chronic diseases. But the health system remains weak, whether in terms of infrastructure, in terms of equipment, and also medical staff. The World Health Organization claims that there are less than 2,000 ventilators across 41 countries in Africa, and this compares to 170,000 in the US. Now, the US has, you know, a fourth of Africa's population, so there is a huge gap that needs to be filled there.
Yeah, an amazing statistic, and really clarifies that huge disparity between continents and nations. You mentioned there, of course, the sort of the poverty levels and some of the systemic challenges that African economies face. To what extent do you think the COVID pandemic will have impacted some of the positive moves that have been made of late towards food security, electricity, clean water, things like that?
I'd say Africa is better placed now with all the developments that have taken place over the year in the areas you mentioned, whether it's you know, food, electricity, internet access. Even, you know, we've seen you know, the numbers grow, but still there is still a huge gap to fill. I mean, economically as well, we've seen, you know, numbers evolve over the years, indicators improve, but the continent is definitely going to take a hit from this.
And in terms of turning to the economy then, in terms of specific responses from governments and bodies that deal with Africa, what tools do they have at their hands to help the economy come out of the other side?
Yeah, that's a good question, Ollie. So there are many institutions. I mean, of course, everyone around the world at the moment is very busy trying to find solutions for all parts, every region. In Africa specifically, there's been quite a lot of institutions that have mobilized to help find solutions to the outbreak. I think one of them is the Africa Development Bank, which issued a 3 billion social bond to fight coronavirus. And this social bond is known to be the world's largest US dollar denominated ever on the international capital markets. It also more recently launched a COVID response facility worth $10 billion to support governments and businesses. So a lot of the support is coming from these kind of institutions. The World Health Organization is also helping mobilize international assistance for the continent. The African Union as well. They've done quite a bit of work actually with the African Center for Disease Control and Prevention, which is an organization that actually emerged in the wake of Ebola in 2015. So this is at a regional scale. We're seeing a lot of institutions who are getting together and trying to bring solutions to the current crisis. At a country level, at a government level, there are definitely some efforts to try and alleviate some of the pressure, especially on like low-income families, rescheduling of tax payments, social security contribution delays. But it's difficult. It's difficult because this pandemic is gonna affect African economies in different ways. Really, I think the hardest hit will obviously be the commodity exporting countries, and that will, with revenues declining, government coffers will dry up. So yeah, it's very challenging times for Africa, and help will be needed to reduce the impact on the economy and on society.
Sure. And when we speak of debts and donors, we've spoken a lot in recent years of China's influence, and China, I think, is Africa's largest lender. Have we had anything from China as to what they might be able to do? Any overtures towards rescheduling debt, for example?
There are talks underway. So China is Africa's biggest lender. It said that 28% of Africa's external debt is owed to China. So there are talks about temporary freeze on payments expected. But the discussions are still underway. On the other hand, we've seen some of the countries in the developed world cancel some or freeze some of the debt that is owned by some of the poorest countries in Africa. So there are discussions underway in other countries as well. The same goes for international institutions. I think the IMF has already cancelled some of the debt payments owed by some African countries.
Brilliant. And just moving on to the private sector, we at Oxford Business Group, talk to a lot of private sector companies. To what extent are they rising to the challenge of the COVID-19 environment? Because of course, so much of it is very damaging to the private sector. However, as we've seen in the West and in other regions, there's opportunity as well. Yeah,
absolutely. I must say it's been quite impressive to see how the private sector has mobilized in the wake of COVID-19. Throughout the continent, really. As you said, this is one of the focus of our economic impact assessment articles that we do on a regular basis to cover all the markets where we're present. In Africa specifically, I think it's particularly interesting to look at countries like Tunisia, for example, where a robot has been deployed and is, touring the streets of Tunis, and it's remotely controlled by police officers who are sitting in their office, making sure that lockdown rules are being respected, and they're able to interact live with people in the street. We've seen other examples of robots in hospitals as well, also in Tunisia. That are able to help doctors diagnose and monitor sick patients remotely and without any physical contact. A lot has been done, in terms of AI-enabled chatbots throughout Africa, and in the sub-region especially. We've seen a lot of governments rely on online chatbots that are AI-enabled. Drones, for example, I've seen an example in Ghana where drones are serving to help transport test kits and bring them back to labs. So a lot has been done in that regard, and a lot of these initiatives have actually been initiated by startups, young entrepreneurs, which is really, really interesting. There's also been a lot of interaction between universities and the private sector. So we've seen cases where universities have been working with an automotive company, so a car manufacturing company, to make face shields using 3D printing and laser cutting, etc. So it's very interesting to see how African nations and the African youth have actually mobilized to innovate and adapt to the current circumstances.
So perhaps the private sector working with universities in the sort of R&D sphere to develop things, in response to a crisis. Yeah, exactly. Fascinating. So perhaps to finish, Souhir, we could perhaps turn and finish with that SME area, the private sector, such an important part of economic development plans and strategies across the developing world. To what extent do you think this might spur on governments to recognise the importance of harnessing and perhaps encouraging private sector startups?
I think it's the way forward. I think it should be high up on every government's agenda to support creativity, to support innovation, startups and young entrepreneurs, because this crisis has really demonstrated the skills that are available locally and the need to harness these skills and invest in them for the future of Africa. Even during this crisis, we've seen many companies and also the institutions like the African Development Bank, the African Union, trying to mobilize funds to support these small enterprises. I mean, after all, Africa, the largest majority of Africa's economy is made up of SMEs, and more of that share is being taken up by smaller companies and startups. So I think it's the way forward. Definitely.
So an upbeat, positive message to finish on against a backdrop of continuing concerns about COVID-19. It'll be really interesting to hear, speaking to you in a couple of weeks' time and seeing how things are developing. Thanks so much.
Thank you.